my great pleasure to introduce a friend whom I've known for many, many years. I think I knew you since you were a student, if I remember correctly, Bob, with Professor Katie. Yeah, and Sherlyn now is she's a Chinese Canadian social worker. She's an author. She's going to share you her book that she has written. She's an educator, and she's a grant-winning artist of immigrant background. Well, I didn't know that. And she graduated from inaugural collaborative master's specialization in social work and Asia Pacific study at the University of Toronto. She's currently a mental health clinician at Mount Sinai Hospital in Toronto and providing cultural and linguistically appropriate psychotherapy and mental health care for Chinese seniors and family care partners. She's actively engaged in enhancing the quality of healthcare by training regulated and unregulated healthcare providers in healthcare communications across various settings in the past decade. I'll let her tell you more about what she does because there's a lot to talk about, but I just want to highlight the importance of being a social worker. From my perspective as a doctor, we cannot survive without help from social worker. Part of it is we take care of patients who are now sicker and sicker, and they're older and older, and it becomes a major challenge that we want them to stay home, so that's one thing. And then if they can't stay home, then where can we help them? And as physicians, we're not very good at that. We're focused on the disease process. I know how to treat heart attack, heart failure, and all this type of thing. But when it comes to the point that, how do we care for them at home? I really count very heavily on my colleagues who are social workers to direct us, or what we call navigations in the system, to make sure they get the best care that they can stay at home if they can. And if they cannot, where to go, how to apply. The process is very complicated. So I end up actually having to have social worker rounds every single morning to make sure that my patients can be discharged. And for my outpatients, I have to refer to appropriate social worker environment. I also do research with social worker. I'm now working with the social worker groups at U of T with Professor Katie Zhang on a number of issues that are related to geriatrics and in particular actually using AI to try to help them. So we'll see how far we can go with that. So without further ado, I'm going to pass the baton on to Sherlyn. And I heard this is very good. So free seer, Sam seer.
Hope I don't disappoint. Thank you, Dr. Chow, for your kind introduction. So good afternoon, everyone. So thank you again, Dr. Chow. Well, happy Asian Heritage Month for those of us celebrating. It's May. And thank you, the Kickstart to New Career Seminar, for organizing community, for inviting me, for warm invitations to speak about a career in healthcare and particularly in social work. So my name again is Sherlyn Hu. By job title, I'm currently a mental health clinician at the Mount Sinai Hospital Wellness Center, providing psychiatric care to Chinese seniors and caregivers who are living in the community in my own languages, so in Cantonese, Mandarin, and also in English. So I am a registered social worker in Ontario, an author of a couple books, an educator. I'm also a holistic nutritionist, if you're interested. I'm a visual artist, and my proudest identity of them all, I'm a mom of two little kids. Okay, so today I'm very happy. I hoped to share with you that a career in healthcare is much broader than the job title. In fact, you may discover that soon enough, what you can do, it can be so brilliant that a job title simply cannot describe it all. When I was growing up, the gold standard in career selection is 3 C's. So in Cantonese, 医师啦、律师啦、会计师啦。In Mandarin will be 医师、会计师，还有律师。But today, I'm sharing with you my own 3 C's. So this is from my own reflections as I look back on my career development, my professional and personal development. So I've come to 3 C words. So before I begin, though, let's get clear on a few things. Let's see if I can. It really likes my 3 C slides, I think. Right? Can you? Or should I point it that way? Thank you. I really does like my slide. That's okay. So before I begin, maybe I can share a few things with you. I think you're in here to hear about social work. So how many of you here know what a social worker does? You can shout it out. Anyone? Not yet? Don't worry, I'll give you a formal definition. Before I start though, even my own parents, they don't really know what social workers do when I first applied to graduate school, okay? You wanna answer? I'm sorry? Navigation, that's a great word, navigation. Anyone else? I love the word connection, navigation, connection. Thank you, Shin. Housing, yeah, but resources, right? Benefits. Thank you, Eric. So that's just a shameless self-promotion, okay? So what is social work? So by definition, as a registered social worker in Ontario, we're all governed by this college called the Ontario College of Social Workers and Social Services Worker. So which means that when you go onto the street, if anyone tells you that you're I'm a social worker or I'm a social service worker, they cannot lie to you. You know, you can look them up on a website. So that's where our college is. So the definition, according to the college Code of Ethics and Standards of Practice, what we do as social worker means assessment, diagnostic, treatment, and evaluation of individual, interpersonal, and societal problems through the use of social work knowledge, skills, intervention, and strategies to assist individuals, diets, so like couples, families, groups, organizations, and communities to achieve optimum psychosocial and social functioning. So live a better life, if I could sum it that way. And in terms of the tasks that we do, it could include many things. Direct practice. Perhaps this is more familiar to all of us, like, you know, navigating a healthcare system, you know, finding the appropriate resources, providing psychotherapy or counseling supports, but also involve things like education. So we're there to, you know, train the next generation of social workers or other healthcare professionals, consultation to offer advice, research, you know, creating new knowledge, social justice to advocate for something, right? Advocate for changes that our society hasn't seen yet that might better a society as a whole. Policy making or human services development. So actually running NGO, for example. So that could be some of the tasks that our social workers do. So we're in a seminar to talk about healthcare. So let's talk about health. So here's the definition I like to go to when I speak about health. Most of us have some idea of what health is, right? At least one of the criteria is not having an illness. Now, this is a little dated, but still rings true by the World Health Organization back in 1946. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmities. So in other words, healthcare, in my eyes at least, health is much more than just fixing an illness. It's about, you know, enabling people, enabling community so that they can function better, so they can achieve their goals and needs in an environment that suits them and supports them. That's how I see health. And I hope that most of our, especially our next generation, will carry that in your mind, that healthcare can be much broader than fixing something. All right. So here are some definitions to get started. So what are my 3 C's? As I reflect on myself, was I invited to this career talk, and you know, how do I summarize my development? So the 3 C words that I really like, at least at this point in time, it can change. The first one is curiosity. Curiosity. So I am a 1.5 generation Chinese Canadian. So how many of you here are 1.5? Which means that you migrated here with your parents from your place of origin. Some of you, maybe. Okay. Well, we came here to Toronto with my parents in the 1990s, before Pacific Mall was even built. So that was quite some time ago. And I'm blessed, so I can speak English, Cantonese, and Mandarin. And I'm really fortunate that I've got the freedom to choose what I study. And what I choose to study was my roots. So the fascinating history, politics, and economy, and the cultural forces that describe the Asia Pacific region. So when I do my undergraduate studies, I study at the University of Toronto. My degree at that time was called Bachelor of Arts in International Relations in Asia Pacific Studies. Nothing to do with social work, nothing. But it really trains me because I really was encouraged to see things from multiple perspectives because I get to experience so many disciplines in my undergrad, economics, history, languages, cultural studies, right? All the things that pertaining to the Asia Pacific region. And as I learned more about the development and the systems at the systems level in my undergraduate studies, I find myself quite curious as to the impact of these, major changes, social changes on the daily lives of people, right? For example, I'm very curious how my parents, who have gone through different movements in China, relate to the world perhaps differently, right? How did that impacted them? Also at the time, I was quite inspired. You could call me chasing an idol. I was intrigued by the work of the then Dean of Social Work at U of T, Dr. Sherlyn Hu. So she was providing crisis intervention and counseling support to survivors of traumatic events at Pearson Airport. So at the time, there was an Air France flight crash in Toronto back in the days. And I thought to myself, one can really make a difference. And even in a very uncontrollable traumatic event at the individual level. So fortunately, at the time where I was trying to look for what next after my undergraduate graduation, the Asian Institute and the Faculty of Social Work at the University of Toronto has come up with a new program, a joint master's in social work in Asia Pacific Studies. So I know nothing about it, but I reached out. So actually, I just cold called the program coordinator at that time, introduced myself, and asked about the program. And a few years later, I was the first graduate of the master's specialization in social work in Asia Pacific Studies, the first one at U of T. So, so I think it's really that curiosity that kept me thinking about, one, about myself, who I am, what I value, what I like, and what am I good at. And this can change, let me tell you. And also it's the curiosity that keeps me thinking about, what would make life a little better for people around me. So that's the first word I give you, curiosity. The second set of words is actually connecting the dots. So I launched into a social work career after my master's graduation, working for a lot of local Chinese communities, organizations, in community support for seniors, in settlement work, working in community health center, so helping more marginalized communities. I think the core question really remains for me is, what is it like for people on the day-to-day? So mental health emerged as a way to connect these little dots for me. So about 10 years ago, almost 10 years ago, I got a really lucky opportunity to join Mount Sinai Hospital Wellness Center, a small but mighty program that delivers in the community psychiatric care in Chinese for our Chinese-speaking seniors and their family members. So I'm lucky here to be presenting with my colleague, who will be speaking later. So what we do here on a day-to-day is that I provide assessment from a social worker clinician point of view. I provide psychotherapy. I provide education, care planning and navigation, and also a lot of community mental health promotion in my own languages. So for example, we run a really cool psychotherapy and skills training group for caregivers who will be at home caring for their Chinese seniors who are living with dementia. So we would train our caregivers to first manage their own emotions, but also learn about skills, practical skills, of how do you interact with someone living with dementia, and how do you elevate their quality of life despite this life-limiting illness. So that's what keeps me going every day. And my education really helps me connect the dots because I can see on an individual level every day, how social forces impact people on the personal level. COVID, right? Migration. If you think back to Cultural Revolution in China, all these things impact people's day-to-day life. And I'm very blessed. I can walk with people on a day-to-day to help them navigate a better life here in Canada. And also trying to connect the dots in other aspects of my life, perhaps out of curiosity too. So I work on various roles in the past decade or so. So I've been very active in training healthcare and healthcare providers, how regulated and unregulated ones, including personal support workers, in communication skills, mental health knowledge, so that we have a bigger, stronger healthcare force that we can serve a community. Also, I've been blessed to co-publish a couple of peer-reviewed journal articles and book chapters on social work, education, and mental health, self-help book too. And also, I am a visual artist, so I illustrate for various in various media. I'll get to show you some of my work later. For example, here's some of the artwork that I've done in the past. So as I reflect, what I do, a lot of these various things, I see them not as random collection of things I just go on doing, but I think they tend to point to some certain values that are very important to me. I think out of all of these things that I do, human connections and nurturing and welcoming community is one of those values. In the arts, in the education, in the mental health care that I deliver every day, I do find myself drawn to these. How do we see ourselves? How do we enable people to see their strengths, right? How do we nurture a more welcoming community so people feel that they belong, right? And so out of this, actually back in 2014, me and my good friends, we actually co-founded an NGO called Between. And this is a little, very small NGO that is to promote or provide a platform for marginalized artists to showcase their work and also to think about ways to improve healthcare through arts. And recently I've just published my book with a grant from New York region on the title is called Everyone Needs Care. It's about how, from a little boy's perspective, how his mother, a personal support worker, is taking care of people living with dementia in the community every day. So I see that art is one of the ways I like to use to enable change and to promote people have more understanding, for example, in mental health. So that's my second set of word I want to leave you. And last but not least, I'm sorry, I'm taking a lot of time. Compassion is the last word. It really resonates with me in my personal and professional development. So compassion, in one way of seeing it, is to recognize the suffering of others and then to take action to help. I think all of us who are interested in healthcare know compassion. This is what guides our work. But I also want to leave with you, the other part of compassion is self-compassion. This is something that I'm learning and try to practice because we can easily see helping others, but I think it's equally important to see, we have to be compassionate to ourselves. What does it mean? Number one, it means extending that kind of kindness to others, also to yourself, to recognize that if you're imperfect, that is okay. And it's also inevitable. We're imperfect. Number two, if you feel like you're inadequate, you're not good enough, all of us feel that way, someday or other, or every day, right? And number three, try to consider a more balanced approach to things, see the positives, but also see the negatives, right? And not to feel that you really over-identify with all of these. So be more compassionate to yourself as well as you think about career, as you think about education, as you think about yourself. So what keeps me going? Curiosity, connecting the dots, and having compassion, especially for yourself. So now if you ask me, what's next? How can you take your previous experiences in healthcare, arts, education, and to a little further and reflect on that in the ways that reflect on your own personal values? Well, I don't have a definite answer yet. Now, yet is a very powerful word. So remember that next time, if you don't have that A's on your 90% on your test, not yet, right? And remember, one thing, and if you want to ask me, one thing I do know, especially in mental health, I think prevention is so much more important than just fixing the illness. So if you think about healthcare, mental health care, think really prevention, promotion, raising our awareness so things don't go so bad, right? And when you look forward and things do not seem so clear, here's one quote I'll leave with you, and hopefully that you enjoy. So here are some of the publications that I have done in the past in conference publications. Some of my latest project and a recent art show that I've done in the Asian Court Library. So this is a quote I want to leave you from Steve Jobs. So we know who he was, right? CEO, former CEO of Apple. So you can't connect the dots looking forward. You can only connect them looking backwards. So you have to trust that the dots will somehow connect in your future. You have to trust in something, your gut, destiny, life, karma, whatever. This approach has never let me down. It has made all the difference in my life. 2018, Steve Jobs. Thank you so much, everyone. Have a good afternoon.